My hope for this case is that the U.S. Supreme Court will realize that the FDA has neglected its duty and has been reckless with the health and safety of women and girls. When the FDA originally approved the abortion drugs, they recognized that these were high-risk drugs. They recognized that women could experience significant complications after taking these drugs. And so because of that, they put into place very basic, essential safeguards to minimize the risk of complications to women and girls. Over the last several years, they have recklessly removed these safeguards, actively endangering the lives of our patients. Per the FDA's own label, approximately 1 in 25 women who take the abortion drugs will end up in the emergency room seeking emergency care. We are simply asking the Supreme Court to make the FDA do its job and put back into place the original safeguards that it saw necessary when it approved them.
So when I was given the pills, I was told to expect a heavy period. I was told to expect cramping, and to take Tylenol and use a heating pad. And that is not at all what I experienced.
They told me that I would experience a double period, and I might experience some light cramping, and that I would be back to work on Monday. A normal period for me would last 4 to 5 days. I bled for almost 3.5 weeks.
Instant cramping, instant pain, couldn't breathe, got nauseous from the extreme pain, and then very quickly started heavily bleeding.
More blood than I could have ever imagined. Cramping was so severe, I had to walk bent over, and I couldn't lay, I couldn't stand. There was no position that I felt I could be in and have relief.
This was so different and so far beyond normal bodily function. Nothing stopped the pain.
It just felt like I was going to be in this never-ending misery alone. I was a woman in labor who didn't know she was in labor, and I had no nurse, no midwife, no friend, no mom to hold my hand.
I was all alone and had to go through the entire experience by myself.
I was so scared, and I was bleeding so heavily, I thought I was going to die.
It was like birthing a baby. I've had 6 children, and it was like birthing a child. And I felt my baby come out.
They did not tell me that I would hold my dead baby, that I would see its eyes and its fingers. I still see it.
The whole process was horrible. The effects of the abortion pill regimen are not empowering. They are dehumanizing.
I still suffer from emotional and psychological repercussions of this medication.
The FDA recognizes that these drugs have dangers, and they've increased those dangers by removing the safeguards that they put into place when they originally approved these drugs, requiring a woman to be seen in person before she was given these drugs, as well as having 2 follow-up visits afterwards to ensure that she wasn't experiencing any of these complications. Then in 2016, they did several major changes, one of which then the FDA said that women could take these drugs up to 10 weeks of pregnancy, despite knowing that after about 8 weeks, the rate of complications starts to increase. The other thing is that the FDA said now women only have to have 1 in-person visit before they're given these drugs, and no follow-up visits afterwards to screen for complications and to ensure that their abortion was complete. And then again in 2021, they made another major change. The FDA then said women don't have to have any in-person visits before getting these drugs. That opened the door for women to be able to get online, order these drugs, and have them shipped to them through the mail.
This case is so important for me as a doctor because every day I see women who are suffering from the FDA's decision to remove safeguards. I see them in my clinic. They talk to me about their experiences alone, at home, in dorm rooms. Can you imagine turning your own bathroom into an abortion clinic? And so every time you enter that bathroom, you have a new trigger of the experience that you've had in there.
This case that's being heard at the Supreme Court has nothing to do with access to abortion. It has everything to do with improving the safety for women and girls who take these drugs.
I'm hoping the Supreme Court will require the FDA to reinstate the standards that they initially had when recognizing that these abortion drugs are dangerous for women and girls. They took them away. They need to put them back because women deserve to be safe.